Automated External Defibrillator. Imagine for a moment a city powered by an intricate electrical grid. With its humming energy lines and pulsing transformers, this grid diligently delivers electricity to every building, streetlight, and home. It operates seamlessly, providing power with precision exactly when and where it is required, much like the heart, which efficiently pumps blood to every part of our body. But then, imagine a massive power surge hitting the city. The lights flicker, the power lines groan, and then suddenly, the city plunges into darkness. This situation is akin to a life-threatening arrhythmia in the heart, such as ventricular fibrillation, where the heart's electrical signals become erratic and chaotic. The heart can no longer pump blood effectively, like the city losing its essential power supply. In such a situation, an automated external defibrillator, or AED, is like an expert team of electricians dispatched urgently to the city during a blackout. They come equipped with a potent device capable of delivering a controlled electrical shock to the city's power grid. This shock aims to cease erratic electrical activity, much like defibrillation in the heart. The goal is to allow the grid's natural pacemakers, the heart's intrinsic electrical system, to reset and restore normal power distribution. Just as the electricians must act swiftly to prevent further damage to the city, ensuring the safety and welfare of its inhabitants, using an AED during a cardiac emergency is a race against time. Every second matters, and the sooner defibrillation can occur, the higher the chances of survival. Moreover, similar to how electricians follow specific safety protocols to ensure their work is effective and safe, healthcare professionals use an AED in accordance with guidelines. These precautions ensure the safety of everyone present when the device is used. By understanding an AED's inner workings and life-saving potential, medical professionals can genuinely appreciate its crucial role in the chain of survival.